Hi, Rob Rothrock here with Rothrock Insurance Solutions, and today I want to talk a little bit about long-term care and some of the strategies to plan around long-term care. Long-term care is first of all, Medicare doesn't cover long-term care, and some people don't know that. Medicare covers skilled nursing for up to 100 days, the first 20 at no cost, but then if you have a supplement, the other 80 days, up to 100 days can be covered. But anything beyond that, Medicare doesn't cover it at all. So now, interestingly enough, long-term care, a lot of times it starts in the home, and maybe it ends up in a nursing home, maybe it doesn't. So for many, many years, traditional long-term care insurance was the way to go. There are really three different ways you can buy protection for long-term care expenses. And something to keep in mind is, and we do have personal experience with this, with my wife's father, who passed away in our home in 2018. And for the last several months, we needed to bring in a caregiver to help her mom take care of him. And it's a real thing. Even for a few hours a day for 5 days a week, that can add up to a couple $1,000s a month or more very, very quickly. And if all you have is a 401k or an IRA, you're taking money out that you're going to be taxed on. So the first way you can insure against that is with traditional long-term care insurance. The second way is you can buy a policy that's kind of a hybrid between long-term care insurance and life insurance. And then the third, there are life insurance policies that have a long-term care rider. Now, the first way with long-term care insurance is probably our least favorite way to cover this expense because, number one, it's a use it or lose it policy. So if you never end up using long-term care, you could pay premiums for 20 years, 25 years, and then if you don't actually make a claim and you pass away, then all that money's gone. And since long-term care insurance is built on a health insurance chassis, there can be rate increases along the way. So that's a little unsettling, not knowing that the premiums that you're paying could go up and very often do over time. So now with a hybrid type of product, or solution that combines life insurance and long-term care. Essentially, if you don't end up needing long-term care and then pass away, there's a death benefit that your heirs will get that can essentially repay the money that you paid into that policy. So it's not a use it or lose it. And then the third way, a life insurance policy with a long-term care rider might give you 2 or 3 times the death benefit as long-term care coverage. And if you do end up using that money for long-term care, there is some amount of life insurance at the end, maybe $25,000. It won't go to zero, but the death benefit decreases as long-term care benefits are used. So, but one of those solutions, especially the last two, the hybrid solution or life insurance with long-term care rider, if you have any concerns about that and you don't want to really have that end up being something that falls on your family to take care of down the road, or dip into your assets where they can make you spend. If you end up in a nursing home, they can force you to spend all of your assets before you can qualify for what they call nursing home Medicare, or Medicaid, I mean. So anyway, if you have any questions, give us a call. Our website's down here. We hope you liked the video. Subscribe to our YouTube page, and thank you.